we had one patient from a remote area somewhere far from Pune, maybe around 200 kilometers. A very common man, very minimal incisions and with very minimal handling of his old surgeries with the robot. And he's able to resume his job perfectly fine, earning good amount of money now. So a complicated case can still have a good results if you have that competency and that good team.
Issues होते हैं. Are these more common in women than men?
Yes, absolutely. There are scientific reasons for it. If you say occasional to Indian patient, it's like they will be keep on doing.
So you say कि नहीं करना.
Yeah, नहीं.
सर ये तो बहुत कॉमन होता है ना सर कि नी पेन घुटनों में दर्द हो रहा है तो तेल लगा लिया, गरम सेक लगा लिया.
When you apply a gel or a oil, it just makes your skin more sensitive.
अच्छा.
किसी को थोड़ा गरम लगेगा, किसी को थोड़ा अलग फीलिंग है. So brain gets distracted, right?
सीढ़ियाँ चढ़ना होता है ना. Is it good for knees or what is it?
Okay, so this question can be opted in a different way. So, at what age it will be better?
अच्छा. Today's guest is Dr. Sachin Karkamkar, a powerhouse when it comes to orthopedic surgeries. An MS Ortho Gold medalist from AFMC Pune, Dr. Karkamkar has been trained across various known centers in India, Italy, Germany, mastering joint replacement, arthroscopy, and complex trauma care. With over 20 years of experience and more than 10,000 surgeries, his work spans across various clinical trials, cutting-edge techniques, and numerous international publications. Decorated with honors like Padma Shri Dr. Sancheti Gold Medal and the Colonel Khare Award, he is a respected voice in orthopedic circles and a relentless advocate for advanced patient-centric care. Stay tuned with us as we dive deep into conversation with Dr. Karkamkar on knee replacement surgeries. Hello and welcome to Sahyadri Health Talks. I am Dr. Tushita, and today we have with us Dr. Sachin Karkamkar, a famous orthopedic surgeon in Pune. Sir, welcome on today's podcast.
Thank you.
How are you, sir?
All well, all well.
कैसा लग रहा है इस podcast
In fact,
में आके?
it is pleasurable because today I'm going to get an opportunity to talk something about a subject which is very close to my heart and about which I'm very passionate to talk about.
We are thrilled to have you on this podcast, sir.
Same here.
But before we dive in today's topic, I wanted to ask you कि आपको, you have been doing this for last 20 years.
Yes.
And what I've heard is you do 500 surgeries per year.
Yes.
That counts up to 10,000 surgeries till now.
But I wish to do more.
Is it? Okay. So how has this journey been so far, sir? आपको हमेशा से यही करना था?
No, as you have introduced me like a doctor, but in addition to doctor, I have one more identity of myself that I have been a very good sports person and I was also a good athlete.
Achha.
So it has always given me a passion for those medical fields wherein the mobility is a main feature.
Okay.
So if you talk about orthopedics is all about movement. Life is movement and movement is life.
Correct.
So when I got through my entrance exam, I was getting all the specialties like say gynec was there, medicine was there, pediatrician was there. But still I opted for orthopedic because this is something very close to my heart. And it relates to my hobbies of sports and athletes as well.
Okay.
So maybe that must be one of the reasons.
So how has this journey been so far?
It has been very fantastic, very motivational. And still, even today, I feel something to do more. So, really speaking, 24 hours are very less amount of time that we have because there is so much of scope to do in this field.
Achha.
So, time is short.
So, sir, before we dive in, deep into knee replacements, I wanted to ask you something. कि आजकल knee pain has become a very common issues. हमने पहले देखा था कि इन जीरियाट्रिक पॉपुलेशन जो एल्डरली सिटीजन्स है उनमें घुटनों में दर्द, जोड़ों में दर्द होता था. बट आजकल तो सर हम में भी होता है. I mean, I also face a lot of pain here and there. So what is the cause behind this?
See, I feel knee pain or any medical orthopedic problem is not only an orthopedic or a medical problem. It has to do something with your mindset.
Okay.
In the sense, for example, suppose a common housewife, if you take in today's era, Indian woman, if she happens to find a time, say 1 hour in the early morning, what she'll always think? She'll always think, in 1 hour, what can I do better for cooking? What can I do
Correct.
better for my kids? How
Correct.
can I make my home more spacious and more decorative? She will never think about her health problems.
Health. So she will never prioritize
in an
her
Indian
health.
scenario,
Yes.
everybody gives priority to their work and
Uh-huh.
lesser to their health.
Acha.
And possibly, I think this is the major issue why we are facing the health problems. In
Mhm.
case of other, compared to other components, if things in 1 hour I can go for a walk, in 1 hour I can go for a meditation,
Mhm.
these problems wouldn't happen. I think
Okay.
the mindset has to be changed more than focusing on other parameters of medical issues, what we talk about, which we'll possibly cover in next of our questions. But I think the mindset has to be changed and one has to prioritize the health
Health.
before your other commitments
So
of the day.
24 घंटे में 1 घंटा तो अपने लिए दे दो.
बिल्कुल बिल्कुल
1
बिल्कुल
घंटा तो.
बिल्कुल.
So I was actually about to ask you this, which you have already partially addressed. So ये जो knee issues होते हैं, are these more common in women than men?
Yes, yes, absolutely. There are scientific reasons for it, and there are other medical things which are because of which females are slightly prone. First of all, they are always short of time. They don't
Acha.
get time to take care of themselves. There is lack of awareness. Suppose you have a knee pain, a patient hardly goes to doctor before say 2 to 3 weeks. She will try all the sorts of things till it becomes unbearable for her, and then they go. So somewhere we are lacking the early symptoms, early signs, early treatment, and that can make them more prone for shifting from mild problem to moderate or severe problem.
correct.
Easy medical attention is not there. They will first go to general practitioners, and then possibly they will go when the things become more severe to a specialist, and that in this shift they may lose some crucial golden time for taking care of their knee.
सर ये तो बहुत कॉमन होता है ना सर कि नी पेन, घुटनों में दर्द हो रहा है तो तेल लगा लिया, गरम सेक लगा ली. तो इनके बारे में आपको क्या कहना है?
These are all known as topical therapies in medical term. So these therapies will do or make you partially better. They are not the curative for it, at least when the things are moderate to severe grade.
Okay.
So it will be funny for you to understand how they really work. So when you apply a gel or a oil, it just makes your skin more sensitive.
अच्छा.
किसी को थोड़ा गरम लगेगा, किसी को थोड़ा अलग feeling आएगा. So brain gets distracted.
Placebo
now then brain is focused more on the skin effects and it is less focused on the pain that is coming on the knee.
Correct.
Like,
so it diverts your mind.
It diverts your mind. जैसे अगर कोई बच्चा शैतानी कर रहा तो आप क्या करते हो, उसको खिलौने देते हो, so that he diverts, that he stops doing the mischief. So it is just diverting your brain from that pain perception which is happening. And so in short, it is not a curative thing. We need to dive deep regarding the reasons of the pain and then accordingly form a protocol how to take care of about it.
So sir, ये सीढ़ियाँ चढ़ना,
right,
सीढ़ियाँ चढ़ना उतरना, is it good for knees or what is it?
Okay, so this question can be opted in a different way. So at what age it will be better?
Achha.
So maybe if you see kids or in a very early adult age group, then going stairs up and down is a good. That is known as a weight bearing exercise for them, and because that will stimulate the new bone formation and make your bones more stronger. So maybe till the age of 30 years or so, I can recommend. There is no magic figure as such, but as per my experience being in this field for so many years, I think maybe we can settle down at 30 years and then see that till 30 years we can consider that as an exercise program. But after that, when your graft starts deteriorating, when the joint starts deteriorating, then this can be a stress for your knee and it can cause you more harm than benefit. So maybe we have so many different kinds of exercises to get a same impact, same benefit that you get from a staircase climbing. So I think it should be used only in a young age group, adult age group, but preferably be avoided for those who are in a middle age or maybe an older age.
Okay. तो सर जैसे आपने बताया ना exercises which are good for knees.
Right.
तो हमें कुछ exercises बता दीजिए सर which are good for knees.
Okay. So first of all, telling the exercises is actually a part of a physiotherapist. It's a big science. See, they can talk about it for so many hours.
Correct.
But in short, if you want to pass on some message, exercises that will make your thigh and the calf muscles stronger will obviously decrease the load on the knee. So these muscles are something like a God given belt. ये ओरिजिनल पट्टा है जो भगवान ने दिया है. तो अगर ये आप स्ट्रॉन्ग करोगे तो आपको आर्टिफिशियल बेल्ट लगाने की जरूरत नहीं है. So this has to be made strong. These are original belts given by you. So do those exercises which will make this muscle strong. But now we need to move more away from the knee as well, because your the leg is like a kinematic change. It is in continuity.
Correct.
So in addition to knee, if you have a strong hip, a strong core muscle, it will be like a bonus. Knee exercise is like a salary. Whatever you do extra is like a bonus for it.
Acha.
So exercises has to be tailor made depending on patient's stage and depending on the time he has. And accordingly, you can take a help of a physiotherapist, which I strongly recommend that everybody should visit them, and they would help to customize the exercises for you.
ओके सर, आजकल ना बहुत चला है ये, मैंने भी पहन रखा है वैसे स्मार्ट वॉच,
Right.
एंड यू नो इवन आई हैव सेट अप माय ओन टारगेट्स ऑफ 10,000 स्टेप्स फॉर एवरी डे,
Right.
बट हाउ बेनिफिशियल आर दीज एंड हाउ इज इट रियली हेल्पफुल?
Yes, walking is definitely going to be helpful. See,
Okay.
we have a revolution from, say, or evolution from, maybe from ancient time to human. So we have been four-legged, then we have shifted to two-leg, and the body will function better when you are standing, walking around. So if you see all the systems of a body, be it your respiratory system, be your cardiac system, be your digestive system, be your musculoskeletal, everything will perfectly function if you are standing, moving around. As long as you will be flat, the system will slow down. So it's like a slow death of all the systems. So walking is definitely going to be beneficial. Earlier, it used to happen without intentions. Today, we have intentionally to do it because we don't have those parameters. The lifestyle has changed so immensely that we are forced to get up, move around.
Correct.
Like already in rest of the world, they have started with the concept of walking meetings. They don't sit and do the meeting. They keep on walking meetings. They have standing stations.
Yes.
So we are focusing more on to get upright and move around so that everything functions in a best metabolic way.
ओके तो सर अभी आते हैं टॉपिक पे, नी रिप्लेसमेंट. तो सर ऐसे कौन सी कंडीशंस या सिम्टम्स पेशेंट्स में होती है? वन ऑफ द कॉमन सिम्टम इज ऑफ कोर्स नी पेन. ठीक है, तो वो पहले तो अपने जनरल डॉक्टर के पास जाते हैं, फिर ऑर्थोपेडिक के पास आते हैं, फिर सो व्हाट आर द सिम्टम्स व्हिच इंडिकेट्स कि knee replacement is a must?
Right. So symptoms, if you ask me, the first commonest symptom is that when you sit for a very long time and when you get up and start to walk around, first couple of steps you don't feel free. The knee hurts you. So long period of rest and then starting off with an activity will give you a pain. जैसे आप आधा पौना घंटा के लिए पढ़ रहे हो, टीवी देख रहे हो, कुछ भी काम कर रहे हो और immediately डोरबेल बजते, आप उठते हो तो आप चल नहीं पाते हो वहां तक. सो दैट इज द फर्स्ट साइन. स्टिफनेस इज द फर्स्ट साइन. सेकंड इज द पेन विच इज इनहिबिटिंग यू फ्रॉम डूइंग योर डेली एक्टिविटीज. आपको बेसिक काम करना है, घर में किचन पे खड़े रह के काम करना है, सीढ़ी चढ़ना उतरना है, घर से बाहर जाके ग्रोसरी से कुछ सब्जी लानी, अब वो भी आपको डिस्कम्फर्टेबल है. So when it is interfering with your daily activities, it is a second sign. Third is the need of painkillers. कि when you feel the brain is always focused on the knee, कि मुझे हमेशा घुटने के बारे में याद रहता है कि हाँ, तो when you feel like you are forced to take a painkiller to do your everyday activities, then increased amount of painkillers on routine basis is not a very good thing. Then in such scenario, you should first consult with orthopedic surgeon, preferably a knee specialist, get the guidelines from him, and then he will customize a program for you, and maybe he will come to conclusion of surgery as a last resort. They will never force you for a surgery on a first. They will try all other options which are available to them, and then they will come for the surgery.
Actually, मेरा यही अगला क्वेश्चन था आपके पास कि सर जब मतलब what are the grounds or you know factors जिसके बाद हम डिसाइड करते हैं कि नी रिप्लेसमेंट ही करना होगा? I mean, because why I'm asking you, I'll tell you this. There's a common fear in people mind कि you know you go to a knee replacement specialist. And he will tell you by default कि knee replacement ही करना है. तो obviously you know it's a myth is what we understand. So इसके बारे में आपको क्या कहना है सर?
Actually क्या होता है कि ऐसा क्यों लोगों को लग रहा है? Because Indian scenario आप देखोगे ना, तो they go to a knee replacement surgery at a very end stage and everything has been in a severe grade.
Okay.
तो अगर उस समय पे इंडियन पॉपुलेशन आ रहा है और पेशेंट्स दिखा रहे हैं, तो ऑब्वियसली मे बी आउट ऑफ 10 5 people are in such a grade that they will obviously require a knee replacement. But this is not true. Whatever Indian fraternity is doing a knee replacement, I'm pretty sure that they always go by a ladder form wherein they will try all other things. What I mean to say by all other things is starting right from activity modifications. Activity modifications मतलब आप आपका ग्राउंड एक्टिविटी, उठन बैठन कम करो आप जमीन पे, अच्छा, सीढ़ी चढ़ना उतरना कम करो. एंड व्हाई दिस इज रिक्वायर्ड? बिकॉज व्हेन यू सिट ऑन अ ग्राउंड एंड व्हेन यू गेट अप, देयर आर 4 times of body weight that is acting on your knee because of the gravitational force. So if you are 4 times, so if you are say if your weight is say 70 kilogram and any average Indian female, and if you're sitting up and getting up, when you get up, it's 280 kilogram of weight that is going to act on your knee, and obviously this will going to make the degeneration go more faster. So that is the reason why we don't advise them to sit on the ground. We advise them not to go for a staircase climbing, because it again comes as a anti-gravitational effect on the knees. That is the first thing that we can do. So when I say this to patient immediately feels, there are too many restrictions. But see, if you follow this, and which is very much easy to follow at your own home, then it will benefit you. So suppose साल में एक बार घर में पूजा, आप नीचे जमीन पे बैठो, कोई दिक्कत नहीं. कभी आप ट्रैवलिंग कर रहे हो, बस कहीं और जगह पे रखते हैं, वहां पे इंडियन ही टॉयलेट्स है, वेस्टर्न नहीं है, यूज इट, नॉट अ प्रॉब्लम. इफ यू आर गोइंग इन सम से विलेज वेयर देयर इज नो गुड फैसिलिटी टू सिट, you can sit on the floor. So if you do this activity once in a while, if it is required, it's fine. अगर चलो सीढ़ियां ही है, एलिवेटर नहीं है, लिफ्ट नहीं, तो यूज करो, नो प्रॉब्लम. बट व्हाट आई वांट टू से इज डोंट डू इट ऑन अ डेली बेसिस,
because don't make it your daily routine kind of.
So this will help us to avoid these. That is the first thing, lifestyle modification.
Okay.
Second comes weight reduction, a very hot topic.
Yes.
Everybody wants to do it.
Everybody wants to lose weight,
but nobody has a motivation to carry on. So weight reduction is not focused upon. If you see the Indian females, all of them have a central obesity.
Yes.
Lot of abdominal fat, lot of thigh muscles, and below knee they are slender.
Yes.
So central obesity is very common, and that's going to load your knee immensely. Third comes to diet. If you want to control your weight, 80% of weight control is by the diet, not by exercise. So diet पे आते, diet अगर अच्छा हो तो आपका weight control में आएगा, आपकी knee पे वजन कम
पड़ेगा.
So in a diet, Indian diets are fantastic. We have a rainbow diet, we have everything of a colorful diet. So but what we need to change in this, we don't want to discard this diet. What we want to change is to change the way we eat them. कि आप रोटी के साथ सब्जी मत खाओ, सब्जी के साथ रोटी खाओ.
करेक्ट.
So,
सब्जी के साथ रोटी खाओ.
करेक्ट. राइस पे दाल मत डालो, दाल में राइस डालो. So we need to just change the sequence in which we
are trying to reduce the
in short carbs and increase the protein diet.
Yes.
So we don't want to make any. So diet, Indian culture diet is such a big issue.
Correct.
With all the things
carb focused.
Absolutely. So that needs to be modified, and then don't feel shy to use a walking stick or a walking walker. Sometimes if you need, so आप walking stick use करोगे तो immediately आप बुढ़े नहीं हो जाओगे. So all these things are to be tried before you try, and then comes the role of some medications as and when required. Then comes the role of some other model, and then the last resort is to go for a replacement. So we need to try all this conservative treatment and then focus for a replacement.
तो सर जैसे हम टोटल नी रिप्लेसमेंट की बात करते हैं, एंड आप तो डे इन डे आउट नी रिप्लेसमेंट सर्जरीज कर ही रहे हो. सो व्हाट आई हैव अंडरस्टूड इज यू डू रोबोटिक नी रिप्लेसमेंट्स,
राइट.
तो एक क्वेश्चन पूछूंगी. ये शायद आई थिंक 1000 टाइम आपसे पूछा जा रहा है. सर ये सर्जरीज रोबोट करते हैं?
No, not at all, not at all.
Help us understand.
So it is to be properly nomenclated. It is something like a robotic assisted surgery. So robo assist us in surgery. Now see, to be successful in life, you need one good, reliable, faithful friend.
Correct.
And for a surgeon, robo is a good friend.
Correct.
Why? Because surgeons are competent. They have a good amount of precision in doing the things.
Correct.
But what we are lacking is the accuracy.
Achha.
I'll explain this in a better way. Suppose I ask you what is the distance between those two fingers. You may say 7 to 8 centimeters. Somebody will say 9 centimeters. Somebody will say 10 centimeters. But if you give this to a robo, it will exactly say it's 7.8 millimeter. So what it is doing, it is overcoming the unintentional human limited errors. So there are human limitations. Everybody has a limitations.
Correct.
So we can't differentiate between 1 millimeter, 2 millimeter with your naked eyes. We can't differentiate between 1 degree to 3 degree. So suppose during a surgery, if I want to cut a bone perpendicular, I may sometimes cut it in 87 degrees or sometimes in 93 degrees.
Correct.
So there is a margin of error of couple of millimeters and couple of angles. So this error has been reduced by the robo. So it has given us a precision.
Achha.
So that is the reason. Achha. So it's like a navigation that you use every day in your life.
Correct.
So if you are going to some unknown place, what you are doing, you are going to use it. So in case there is some difficult scenario, or bad knees because of congenital anomalies, birth defects, old fractures, n number of things. This is an unknown territory because that is a complex case, we don't know. So robo helps in that to give a precision. In certain cases wherein there are some old implants there, so robo has an advantage that you don't need to remove this old implant, don't need to do a second surgery for removal, you can directly go ahead and do. So there are a number of reasons by which the robo is going to help us.
So in short, it is done by a surgeon, but it is robot assisted.
Yes.
सर ये जो TKR है, इसके पोस्ट TKR, इसके कुछ कॉमन रिस्क्स टाइप के कुछ चीजें होती हैं इसमें, रोबोटिक TKR के रिस्क्स?
Not per se to the robo, but we can talk about this as a complications for a knee replacement surgery.
Okay.
So by and large, in a present scenario in 2025, the amount of care that we are taking inside an operation theater, the amount of team that has been boosted up, trained, is so fantastic that the reduction in the complication rate is to almost 1 to 2%. And this rate is at par of the global scenario. So I'm not talking about complication rate only in India. Same complication rate may happen somewhere in US or Europe or some other Asian countries. So it has been considerably reduced. So human errors have been reduced, but certain times we have to depend on body's response to the surgery, and this can happen in case you don't get an appropriate response from the patient side. So the most common thing what we see is like deep vein thrombosis, the blood clot that are happening into the blood vessel, that is because of reduced mobility. So we are taking preventions by giving some anticoagulants, some blood thinner agents, motivating them to do some good exercise program, using stockinets. So that has been overcome. Certain things like fat embolism, that is, the bone is filled with a marrow, there is a marrow inside. When you insert the implant, sometimes this bone marrow can expel out, go and give some choking effects on your vital organs, and that can sometimes give you a complication. But if you ask me, the incidence rate is less than 1%. And then comes the infections. Infections is a big risk for us, is a big no, because replacement is a premium surgery for us. So there is big no for infections. And for this, what we need to do is to optimize the patient. So we want patient to come into the operation theater when he is in healthiest form. So you optimize him. So somebody is having a low hemoglobin, you increase the hemoglobin. Somebody is having a low protein, you improve his protein. Somebody is weak by sugar levels. Because every third person is a diabetic, every third person is a hypertensive. Take a physician opinion, stabilize him, optimize him, get to the OT, and then do it. By this, we are able to reduce the complications. So theoretically, yes, there is a risk of complication, but practically, if you ask me, the risk is now we are trying to go very close to 1-2%, or in fact, we want to be 0%.
अच्छा, तो सर ये जो TKR सर्जरी है, इसके कोई कॉन्ट्राइंडिकेशंस भी है, मतलब कुछ ऐसे टाइप के भी पेशेंट्स हैं जिन पे TKR नहीं कर सकते?
Right, biggest thing as we spoke about is the infection. Somebody is having an infection, let us first cure that, and then go ahead. He's a big contraindication till infection becomes zero. Second is maybe a physiology of that patient. If he's not able to sustain that procedure, see, my job is a mechanical job. जो खराब है उसको निकालना है, उसकी जगह पे अच्छा न्याय joint. So mine is a mechanical. The biology should support. Patient should tolerate that. So if somebody is very elderly, very frail, he's not walking around, and he's having some neurological problems because of nerves, muscles, some major cardiac issues where cardiologists are not very happy to give a fitness. In those cases, I will possibly try to hold on and use other resources to make his activity more better.
So moving on to the next question, there's a lot of talk about injections which can delay the knee replacement surgery, or which can, अगर हम layman terms में बात करें तो injections ले लो, some people say that कि उसके बाद knee replacement की जरूरत ही नहीं पड़ती. So these are typically gel injections, PRP injections. So what do you want to say about these?
So it depends on the stage when you see the patient. So injection definitely has a role. But if you see the algorithm in which the arthritis progresses, so maybe we call it in a medical term as a stages, stage 1 mild, stage 2 moderate, stage 3 maybe slightly more than moderate, and stage 4 is severe. So injections will work in very early phases, maybe stage 2 and stage 3, when the knee is not that bad to go for a replacement. So injections, they help to delay the procedure. And how do they delay? These injections are not of steroid. Earlier we were giving steroids, but there is big no for a steroid nowadays. There are very, very minimal indications to go for a steroid. Maybe somebody is having a rheumatoid arthritis, inflammatory arthritis, a different kind of reasons to have a knee arthritis. Then this steroid has a small subset of role. But in 99% of my patients, the injections what we give are known as the gel injections. In a layman language, it is a gel. So this gel is made up of fluid which has the same chemical consistency, same chemical parameters that you have in a normal synovial fluid of a joint. So you are just replacing the normal synovial fluid, and this fluid gives you a lubrication effect. जैसे किसी मशीन में आप ऑयलिंग करते हो तो मशीन विदाउट फ्रिक्शन चलेगी, तो इट इज लाइक एन decreasing the friction of your joint.
Correct.
By that they help you, and this is like a mechanical effect. Now what we have moved on one step ahead is to go for a platelet, as you said, is a stem cells or a platelet injections.
yeah.
Now we got a mechanical effect, but we also want a biological effect. Dil mange more, you want more and more things to add on into your knee. So maybe a platelet, what it has a growth factor, so it will help us to grow the cartilage better. To whatever cartilage you have, it is not going to make you knee cut. See, cartilage is a tissue which will never regrow. There are certain tissues in the body which never grow, like your cornea, brain cells, also some. Similarly, cartilage doesn't regrow. So whatever is damaged, it doesn't do much about it.
Okay.
But whatever is left out, it will help to make it more stronger. So that this healthy cartilage will pull on couple of years for you.
Okay.
So injection do have a role in a mild to moderate cases. It will fetch you couple of years more. There is no magic number how many years it may delay, because there are other factors which are acting on your knee. And so they should be tried before before directly jumping onto your surgical procedures.
Okay, so these are also a part of maybe partial conservative approach before knee replacement, we can say. So sir, जो ये जो knee replacement है, इसका एक बहुत बड़ा fear है लोगों के मन में कि ये टिकता नहीं है. It doesn't last long. तो मतलब I have to heard people saying कि अभी करवा रहे 10 साल बाद वापस करवाना पड़ेगा.
Right.
तो सर इसके बारे में क्या कहना है?
Right. So yeah, this is a very common concern. The fear is that कि मैं आज इतना distance चल पा रहा हूँ, उतना चल पाऊंगा या नहीं. So they don't have a predictable assurance or results expected. Okay. And this is not true, because there is no limit for the progress that you can achieve after the knee replacement. There are so many advances being done. Coming to the implants first, so these implants which are put in knee replacement, these are made up of those metals like titanium, chromium, cobalt. On this metal, there has been a lot of research done for years together, and it has been proven that these metals have a less friction. So don't have a friction. So something which doesn't have a much friction, the coefficient of friction is minimal. So they will last longer. So what scientific data suggests, not only from India, but from Australia, US, Canada, or maybe all over the globe, they will last at least for 20 years, 22 years. And more than that, if you take a proper care of that. If you take a proper care in the sense, the post of things that has to be followed. If you follow that, we can expect more than that. So it will last definitely for a longer time. तो जैसे आप एक नई गाड़ी लेते हो, तो आप वो खराब रास्ते पे नहीं चलाते हो ना, आपको लगता है कि वो बहुत लंबी चलनी चाहिए, बहुत दिनों तक चलनी चाहिए. So you take a care of that vehicle. So
the implant
knees are more precious than your vehicle. If you take a proper care, they will last longer than
because
that.
They're end of the day, these are not the natural God gifted ones. So we have to take care of that so that it lasts longer. Sir, और एक जो commonly हम बोलते हैं ना कि जब TKR करवाएंगे, so usually patients में क्या होता है, घुटने में दर्द है, पता है TKR करना है, बट एक कॉमन फियर होता है कि अभी तो फिर भी थोड़ा बहुत चल पा रहा हूँ, या फिर आई एम एबल टू डू माई रेगुलर स्टफ, थोड़ा दर्द होता है, बट पोस्ट TKR ये भी नहीं होगा, मैं तो पूरा बेड रिडन हो जाऊंगा. So why I'm saying this is because I want to understand from you कि what are the common post-op things after the TKR surgery that patients need to take care of, or what are the things that needs to be done post TKR?
So it's a big myth. Patients, 99.99% of patients will go walking from the hospital. That is pretty sure, because after the surgery, like I'll just tell you in a brief how the things move on once you are admitted and once you're gone through the procedure.
Yes, please.
So on a day of surgery, obviously the patient is under anesthesia, but still then, even then, we permit them to start off with the movements. So we have a physiotherapy team who will visit them in a couple of hours after the surgery.
On the same day?
On the same day, couple of hours, and start off mobilizing them on a bed, from turning from one side to another side. They'll apply the machine, start off mobilizing your knee joint. See, there is no need of a rest.
हाँ.
The sutures, the implants, they are so strong that your movements are not going to damage them.
अच्छा.
In fact, we recommend them to do the movement, because more the movement you do, less will be the chances of stiffness.
अच्छा.
Better will be your muscle strength, better will be your blood circulation. So movements are strongly recommended from the day of surgery. Second day, they usually sit, they have their breakfast in a sitting hanging position. In the evening, second day, they are able to stand, and maybe on second, third day, they are able to walk also.
So post-surgery, the second day, they are made
They
to walk.
They are going to walk. That is a routine
lovely.
scenario that happens.
Oh, lovely.
But yes, they will walk with the help of a walking aid,
Yeah,
walker, because many of them are elderly, they have an apprehension, they may have a balance
Correct.
issues.
Correct.
We don't want them to be on a back foot because of some certain issues.
Correct.
So with safety, with mobilization, they get a confidence. तो पहला तो आपका जो doubt है वो तो outdated. मतलब patients will definitely walk.
अच्छा.
And they will walk from one room to another room, from their bed to the washroom. So they are self-dependent. जब आप घर पे जाओगे, so there is nobody needed to take care of you. You'll be able to come out of bed, move around, go to. तो जो एक डिपेंडेंसी का फील रहता है ना कि हाँ, we will be dependent,
bedridden हो गए पूरी तरह से,
किसी को सेवा करने की जरूरत पड़ेगी, तो वैसा बिल्कुल नहीं होता है.
अच्छा.
So they are made by the physiotherapist team. They are so groomed that they will be able to take care of them.
So
that gives the confidence.
How important is this, physiotherapy and role of rehab post TKR?
Yes, it's important. If you ask me in a shortest, briefest way, if I want to say, it's TKR is a teamwork.
Achha.
So a patient, doctor, and a physiotherapist.
Okay.
Each one have to do their 33% of part good to have 100% result.
Beautiful.
So that is the importance of a physiotherapist.
Achha.
So to make it more simple, suppose if somebody wants to ask me, what exactly is TKR in a very simple or funny way. So TKR मतलब कैसे गाड़ी के टायर बदलने जैसा.
अच्छा.
तो गाड़ी का इंजन स्ट्रांग होता तो गाड़ी दौड़ेगी.
Correct.
So if you just replace the knee,
correct,
which is your tire, but if you don't have a good strong engine, which is your muscle, you're not able to walk. Correct. So making your engine strong is a part of a physiotherapist. They help you to tone your muscle, they help to recruit your muscles, they help you to mobilize your muscle. See, the strength is not going to come with your imported implants or by robotic technique. The strength is going to come from your own native muscles, ligaments, your core, your good cardiac activity. So hence the importance of a physiotherapist. So they will be requiring a physio, which will be continued even during their post-op period when they'll be going home. The physiotherapist will go and visit them every day in the home for a couple of days. And as they get better, the need on this physiotherapist will be reduced. So grossly, maybe for first 3 months or so, they will need an assistance. But in bits and pieces. So they'll come, they'll help you out for exercise program, which you will do for next 2-3 weeks. Then they will upgrade the program.
Okay.
So if you ask me the fitness or success of the surgery, it depends on 4 factors. First is the flexibility. You have a good movement. Then comes the strength, that is the endurance to walk. Then comes the balance. And then the 4th pillar is your daily activity, what all things you want to do. So flexibility, strength, balance, and the activity. So these 4 pillars of mobilization are being made strong by the physiotherapist. So they play a crucial role.
So, sir, if we ask you that, tell us a few things that are a big no after a TKR surgery.
Okay, so very happy to say there is nothing very big no to mention except for the activities of sitting on a floor.
Which is also you are saying कि occasionally तो बैठ ही सकते हैं, मतलब कुछ
पूजा हवा Indian scenario में अब जब occasionally बोलते हो तो occasional होता नहीं है वो तो they keep on doing everything from the next possible day. So there are so many patients even after saying that don't do these things, they will come and sit cross-legged, they'll do all sorts of things in spite of saying them no. So if you say occasional to Indian patient, it's like they will be keep on doing it.
So you say कि नहीं करना.
Yeah, nahi karna. So sitting on a floor is a big no, because what happens when you get up, as I told you earlier, there are a lot of forces coming on the knee. So the longevity, we feel that the longevity of knee may reduce if they do it frequently. Secondly, in case, unfortunately, if they lose a balance, they may sprain any of the ligament in the knee, and then again the rest will be required for 2-3 months, and that will delay their progression. And then once you make an elderly patient sedentary, believe me, it's very difficult to get him out of bed again. Correct. So we don't want to have those kickbacks from our surgery. So it's better that we need to avoid. It's not that they are not able to sit, they are able to sit. In fact, after knee replacement, hip replacement, you may be even seeing so many photos on the social media. After the surgery, the patients are sitting in all the ways they want.
Yeah.
But it is just a way to motivate. It is not recommended to do that thing.
That's
So that is a big no to be done, sitting on the floor. Apart from this, there are no other major restrictions. You can walk as much as you want. You can stand as much as you want. I motivate most of the patients to consider for a cycle, which they can do an outdoor cycle or maybe a gym cycle with a low resistance. Obviously, we don't have a lot of force on the resistance. The best thing that they can do is swimming. Swimming is the best sport.
Actually, मुझे आपसे ये भी पूछना था सर कि walking better है या swimming?
Both are good. Walking is good. Swimming is very good.
Swimming is very good. Okay.
So why? Because if you see, when you swim, there is no ground reaction force that is coming to your knee. You are floating.
Correct.
There is no worries about hard surface, uneven surface. All those things have been taken care of. So the floating surface itself makes the exercise program very easy. Secondly, when you are swimming, the water resistance helps you to develop the muscle strength. So the strength is taken care of. Many of the patients of a knee, in case I want to quote, maybe 80% of them may also have a back problem. So the back care is being taken off because you are doing an extension type of exercises.
Correct.
When you swim, there is a breathing exercise has to be done.
Yes.
When you swim, there is a cardiac exercise. So in a nutshell, it is like a package, combo package. You do a swimming for say 45 minutes a day and you are done with things. Whatever else you do is a bonus for you.
Oh,
so swimming is a great exercise. What I'm worried about in this patient is getting in and out of the pool. So we need to train them to use it properly, how to get. If that is done, your major thing is done. I'm not worried what they do inside the because that's going to be safe. Even if you're not able to swim, even if you just walk around or do the paddling on the edges, even that's going to benefit you.
Okay. So moving on to the next section of this podcast, a quick few myth busters. इनमें से ज़्यादातर हमने discuss कर ली है, but still, I'll put it across as a layman term. Right. So the first myth buster is, I'm too old for knee replacement.
Right. So when you talk about age, it's your physiological age and your biological age. Your biological age may be high, but your physiology age is good. There is no age bar. So the oldest patient that I must have operated maybe around 85 or 90 years old. He was a yoga teacher, physically stout, maybe like any other person who is 50, 60 years old. So age is just what people say is a number. It's your physiology, your physical capacity, how much you are able to tolerate that procedure. So age is no number for me.
You should delay the surgery until the pain is unbearable.
So by doing this, you're making the simple things more complex. Waiting is going to make the things more complex because when you wait, obviously you have a pain, so you don't happen to walk more. So if you don't walk more, your bones are going to be weak, your muscles are going to be weak, you're going to have lesser cardiac activity. So your body physiology will shrink. And then when the body physiology shrinks, you'll not be able to tolerate the procedure. So Indians have a very good willpower. With willpower, they will prolong as much as it is at a stage where you are not able to go to the washrooms also.
सहन शक्ति बहुत है हम में.
So that is going to make the things work. Because if the things become complex, there are many things that happen in surgery. A small incision will become big incision. The tissues which are released, we need to release more tissues. The normal implants we use, we need to use a custom-made longer implants. And so it will add on to complications. So better not to. So knee replacement should not be done too early. And also it should not be done too late. We have to be optimized the stage or time when you to do that.
So listen to your doctor.
Yeah.
If your doctor is saying you need one, then you need one. Okay, moving on to the next one. You can't do regular chores after a knee replacement.
What do you mean by that? Regular activity?
Regular activity,
You can do. What more you want to do? You are able to walk as much as you want. You're able to stand as much as you want. You're able to climb stairs.
So it's a myth, complete myth.
Absolutely. So you're able to do everything except for the thing which you spoke, not to sit on the ground. Otherwise,
I'll always walk with a limp after TKR.
Not at all. Not at all. This is completely false.
Achha.
Because with Robo, we are able to have an accuracy of 0 degree. The legs will be absolutely straight. So there is no question of having limb length problems. And if you have a good muscles, you will absolutely walk with a straight limb. So my target to my patient is that when you walk, nobody should identify that you have been operated. Your walk should be that good, like a normal.
And that's the whole purpose.
And that is very much possible. That's very much achievable. So we can walk without a limb for sure.
It's immensely painful.
It was a couple of years, I may say, and we are really trying hard to decrease the pain. To be very honest, I can say maybe we are able to make a intolerable pain tolerable.
Acha.
First 2-3 days, patient may definitely have some pain,
Surgery है
but
pain
believe
तो
me, we are trying at all the levels. I'll elaborate more on this. See, what do you mean? Once you give an anesthesia, we give by spinal, that is your spinal cord is made numb. That is one way to have a pain relief. Second is during the operation, we inject so many analgesics around the knee. So the local level is being taken care of. After the operation, we give blocks to make that nerve numb. So it is taken at local level. Then we give IV injections if required. That part is there. And then in addition to that, we have transdermal patches for the pain. So believe me, we are working on all the possible modalities for the pain. But it's a natural what you can say response of the tissue. तो उनको छेड़ोगे तो आपको थोड़ा kickback तो बैठेगा because they are going to respond you back. So maybe first 2-3 days you may have a tolerable pain and then gradually it will go down. It's also the mindset. See, if you are very sensitive to the pain, then it gets amplified. If you understand, if you accept that, okay, there's going to be some pain, then automatically the pain goes down. So there are so many hormonal things happening in your mind.
Correct.
So again, coming to the advantage of, so if you have a positive endpoint, if you're doing an exercise, there are, say, endorphin that are secreted.
Yes,
so endorphins are normal painkillers.
Happy
So you have a
hormones.
painkiller free of cost in your body. It's like an internal pharmacy with you. So with those good mindsets, stress free, with good exercises, we are trying best for the pain.
Next one is quite interesting. Eating bone marrow makes your bone strong.
No, I am a vegetarian. I don't eat, and my bones are pretty strong, and like any other vegetarian, it will be strong enough. So that was because possibly they want to highlight more on the need of a protein.
Acha.
Because what we get from a non-veg diet is a protein diet. So protein obviously is good for your muscles, and that is the reason they make. But it's not mandatory. If you love to have that, have it. Not an issue. But if you don't like it, it is not mandatory for you.
So the next one is, can only calcium supplement make your bones healthy? Is protein equally important for bones like calcium?
Both are important, calcium as well as protein. And because the term calcium has come, I'll take this opportunity to tell that in Indian scenario, 90% of females don't take calcium. So after the age of 50, when your menopause starts, there are so many hormonal things happening in your body. So those hormones which are responsible for formation of calcium, they're dead now. They're no more working. So you have to take a calcium supplement externally in addition to a good balanced diet.
Acha.
Calcium supplement is not a substitute for your diet is not a substitute for calcium. So both are required, and this, if calcium is not taken, your bone will start dissolving by the rate of maybe 0.3% every year. You'll become more osteoporotic, and
so
osteoporosis will have an impact on knee replacement because your implant is being held by the bones. If the bones are weak, then the implant will not have a good hold. So जैसे आप किसी दरवाजे पे नेलिंग करते हो, नेल तो अच्छा है लेकिन पकड़ अच्छी नहीं तो लूज आउट हो जाएगा. So that will impact your bone. So calcium has to be regularly taken.
सर कौन से एज ग्रुप से आप सजेस्ट करते हो कि कैल्शियम सप्लीमेंट?
So maybe around 45-50 should be a good time. Yes. And to go more scientific, there are certain tests to be done like BMD, bone mineral density, which will give you an analysis for a complete body calcium, and that is the right way to go about it.
One more myth is you cannot get both the knees transplanted at the same time.
Right. We can do both the knees together. In fact, 90% of patients get both the knees together.
Achha.
So we can do both knees together. It depends on body's physiology. If somebody is having a medical problems and they are controlled, if you are having a diabetes, but it is under control. The cardiac issues are under control. The physician is happy about the anesthetist is happy about his fitness, then there is no point to wait about it. So we go in certain cases where the things are not under control. In those patients, we can go in a stage way, doing one knee, which is more painful, and then once he settles down after maybe a couple of weeks, then we can go for a second knee.
Okay. Physiotherapy is not a mandate post TKR.
It's the important thing. It's
the 33%.
33% factor. Yes. It's a mandate.
So it's a mandate thing. So, sir, I have one personal favorite question, which I
Yes.
love to ask my doctors, which is what has been share a most complicated case or a case which is very close to your heart, which you have
Okay,
operated for
so
40.
there are two different things. A complicated case is there, and
हम दोनों सुनेंगे.
yes,
आप
बिल्कुल,
दोनों
बिल्कुल,
बताइए
बिल्कुल,
हमें.
बिल्कुल. So we had one patient from a remote area somewhere far from Pune, maybe around say 230 kilometers. A very common man who had a very bad fractures in his knees, was splitted somewhere. He was carrying out for so many years, and then he had all the sorts of implant plates, and this was very well managed with very minimal incisions and with very minimal handling of his old surgeries with a robotic, and he is able to resume his job perfectly fine, earning good amount of money now. So a complicated case can still have a good results if you have that competency and that good team to take care of it. So by the team, we need a team of a OT staff, a team of physiotherapists, good techniques. So that is very much possible to tackle a complicated case. A favorite one, if you ask me, maybe a lot of patients to me come from old age homes. So they have their kids for a work purpose been abroad, nobody to take care of them. And they reach us very late stages. So we had such one of such patient who came at a very late stage, barely able to walk and move around. We did a procedure on her, and over a period of 3 months, 6 months, she improved to such a good extent that I met her just a couple of weeks back. She had been back from her Europe trip from her son who happened to live there, and she was so happy with the improvement that gives you a satisfaction. So, in a medical science, you don't believe we put so much of time and energy of your young age working around for maybe say 10 hours, 12 hours, 14 hours, 16 hours at curtain side. And after putting so much of what we can say time, energy, if you get such a good, fantastic results, you really feel happy with it. It is not about only the financial part that I talked about the medicals, but it is also a satisfaction part that is less talked. That stimulus or that impulse helps us or motivates us to do more, better and better. So we have so many patients. It's difficult to quote and remember and tell you about it now, but we do have a good success stories and hope to have many such more in future.
We wish you all the best for that, sir. Once again, thank you so much for coming on today's Sahyadri Health Talks. Before we end this episode, do you have any message for people out there who are watching this podcast and who might need a knee replacement surgery very soon, but for some reason they are not able to come to you because distance and all that stuff? So what message do you have for them?
Right. So this is a very important question. So in a brief way, what I can assure from my experience of last 20 years in replacement, if the patient comes walking to your OPD, after the surgery, he will definitely go walking out. If a patient comes in a wheelchair on a bed, after the surgery, we do not assure them you will go walking. So don't delay the surgery to that extent that you are unable to walk couple of steps, because surgery is not going to make miracles and make you immediately walk.
Correct.
Whatever backlog you have for so many years, the surgery is not going to vanish it in within couple of days or weeks. So don't delay it till a very end stage. To reach out to your nearest good center, take appropriate what you can say instructions from them, kill over the fear of or apprehension that you will not be able to walk. There are so many reasons. Thousands of patients who are moving around, walking around, doing their daily activities without any issues. So that will be the message: to don't delay it for a too long time.
Thank you, sir. Thank you so much for this wonderful information that you have given us. I wish I could continue this for longer, but then looking forward to have you again on Sahyadri Health Talks, and we can discuss some more topics.
Sure, it was pleasurable too.
Thank you, sir.
Thank you.